Hey Tom, good to see you.
Good to see you, Jack.
Thanks for taking the time because I know you're moving, and this is impromptu, but I really appreciate you taking the time to so we can have a nice chat about fillers and what's going on, and more importantly, your technique, which has been around for quite some time, but I think it's becoming much more relevant with what's going on these days, with people getting kind of sick and tired of getting their faces overfilled. But you know what? Before I start with anything with our serious discussion, I'm going to say I always wanted to meet Van Gogh, the famous Dutchman. But now I'm getting to meet the famous Van Eyck, the guy,
Well,
right, in aesthetic medicine. So to start off, I mean, you've been doing this for a long time, and
yeah.
you've seen all the different trends, and some of the trends have been good, some of the trends have been not so good. But the one thing is, we're kind of getting away from people wanting to overfill their faces, and they're actually getting scared of getting hyaluronic acid placed in their faces. So, what's your take on that?
Well, I think we live in a bubble. I mean, we doctors and our patients, we kind of accept the fact that everybody wants fillers, everybody likes fillers, and they think they look great. If you talk on the average Joe on the street, it's a whole different story. And I don't know about the situation in Toronto, but here in the Netherlands, if you ask an average woman or man, what do you think about fillers? They say, "Ugh, I don't like people being filled, right?" And in fact, that is something the industry has been promoting for a long while because I think they figured that if you teach someone to fill a face with 10 syringes, you make 10 times the amount of money you would make if you would just use one or two syringes, right? Um, so I think the outside world always was anti-overfill. And now it seems to be like it's entering our world and it's damaging our businesses that people are vocal about not wanting to have those pillow faces.
Yeah.
And as you said, I've been around for a long time. I've been doing this for 20 years, promoting the minimal use of hyaluronic acid, of dermal fillers, in order to correct what age and nature has done to our faces, but not overfill.
Right.
And I think the overfilling a lot comes from um, what they call a liquid facelift.
Yeah.
So you take a face which in time gets more skin, and to compensate more skin, you're gonna put in more volume. It works, but it doesn't make any sense. I mean, it's like when your sweater is too big, you're not gonna go to McDonald's to gain 10 kilos in order to make it fit. It works, but it doesn't make much sense. Um, And so I think it's that idea of trying to overcompensate the abundance of skin with too much volume. I think that's the technical thing, which is, in my eyes, wrong. Um, Fueled by the aim of the industry to try and sell as many syringes as possible. And then, of course, we as doctors, we want to make a living. So we're biased to trying and sell syringes because we get paid by the syringe. So yeah,
So,
it does make sense.
I think you brought a very good point. And for me, I see a lot of patients, and obviously I'm a facial plastic surgeon. So, surgery is what I do. But I see a lot of people who are coming in and they're saying, can you give me volume here? Can you give me volume here? Can you give me volume behind my hairline so we can get that lift, right? And
Yeah,
there's this pause that I take and I go, it makes no sense to do those things. And so I think that combination of social media as well as what you said, the drive by industry to have us, you know, make a lot of money through putting a lot of injections into the patient. I don't think that's kind of done a good job in terms of the end results we're producing at this stage.
I
And
agree.
And so I think I find your approach very interesting because I think you're able to deliver a very good aesthetic outcome, a very natural outcome. And I also think that Europeans versus North Americans have a very different perspective of what beauty is. I find that North Americans tend to be wanting to be more overfilled, overdone, whereas Europeans want to be more natural looking. That's just my perspective, just, attending meetings and talking to other people. But
Yeah.
again, going back to your technique, I find that it's incredible what you can achieve with not as much filler and just putting it into the correct plane where you can do that well done aesthetic correction. So, can you tell us more about like the thinking behind your technique and what are you trying to accomplish?
Well, the two things you that go on simultaneously. On the one hand, you have the aging phase,
Yeah.
where you can see the skin getting bigger, the volume reducing, and the strength of the skin reducing. So the three elements of aging which come to mind. On the other side, we have the hyaluronic acid filler, R2, which we're being taught to use it as a filler.
Yes.
And of course, if you put it underneath the skin, it fills up. But I found that if you put it in the skin, it strengthens. Then, if you look back at the fact that part of the aging process is the lack of strength, then strengthening is something you need next to filling.
Hmm.
So instead of using the gel for just one purpose, now you can use it for two purposes, which means you don't need to overfill to compensate for a lack of strength, which never worked in the first time. And on the other side, you have to be honest that the abundance of skin is not something you should treat with an abundance of volume.
Hmm.
So you leave that to surgery in order to correct that amount of, of skin surplus.
Yeah.
That's the basic.
So, who's sort of the ideal patient population for the procedure? What age groups do you think would do well with it, or is it all age groups that would do well with this?
Well, it depends on what your diagnosis is. And that's what I teach in my classes. This is such a weird field of medicine because we do treatments without a proper diagnosis. We suggest a chin enlargement or we suggest a jawline, which is not an illness, right?
That's
We
true.
haven't even we haven't even addressed what's really wrong with the skin.
Right.
Um, so if you think of that tool you have the filler slash strengthener, depending on in which plane you are. Um, Anyone who has a damage in their skin strength would be a great candidate for strengthening.
Hmm.
And anyone who has a volume depletion would be a great candidate for volume.
Right.
And most people have both. Um, the Fern pattern technique is a technique which allows you to inject in this fashion from the fold or from the line in two directions.
Hmm.
Will be most effective when you have a dermal diagnosis, dermal damage, like sun damage or movement or scars like acne scarring, anything that interferes with the integrity of the strength of the skin is a dermal issue. If you have a dermal solution, it fits your dermal issue. If you have a perfect skin, there's not much to strengthen.
Right. So, bottom line is this is ideal for people who are noticing that there are changes in their skin. They're getting the fine wrinkles or the deeper wrinkles. So that's good. That's a good clarification. Now, can this be a panfacial rejuvenation? Or do you find that this technique works better for certain areas, like let's say the crow's feet or perioral area?
Anywhere where you can find a linear dermal weakness, and it's most obvious here, people will come for the marionette folds. That's what they see in the mirror, and that's like indicative of getting older.
Hmm.
So you might want to address these first. But there are certain parts in the face where you can actually if you can look for them and you find linear dermal weaknesses like here.
Hmm.
And you know from surgery, this part of the skin is very well attached through ligaments to the skull.
Yes.
This part is not.
Yes.
So anything that will connect these dots will improve the suspension of the face of the lower half of the face. Um, I will not call it a lift, but you can imagine you can reduce sagging by strengthening this area. And if you push it up like that, you can actually find where the linear dermal weaknesses are, which will indicate where to address the strengthening.
So basically, you're saying that, through a superficial injection, strengthening of the skin structurally, you can actually, as you said, you don't call it a lift, but you do see a upward migration of the skin or redistribution of the skin.
Yeah, relatively.
Okay.
Imagine imagine laying down on your sofa and putting a sellotape from your hairline there
Hmm.
and then sitting up. This will be a little bit higher in comparison to that side.
Okay.
And of course, lifting is a surgical thing. Lifting is really grabbing the material and grabbing the smooth and bringing it to a higher plane. But reduction of sagging is very interesting.
Now, the one area that I think we overlook or we don't have as good of treatment options is actually the neck, right? A lot of patients will come in with laxity in the neck.
Yeah.
And do you think that this technique works well in the neck? Could you use it in the neck?
I use it when there's a real well-defined line. Um, I mean, every time you bend your neck, your skin will decide to fold somewhere.
Hmm.
And the folding itself will damage the skin. So, like a piece of paper, if you fold it 100 times, it will fold at the same place all the time because that's the most vulnerable part because of the folding. So, if you strengthen that, you redistribute the weakness and you reduce that one line. What we see a lot in the necks is there's an abundance of skin, which is excellent for surgery, or just an overall loss of integrity, of strength of the skin, which can be addressed with things like PLLA.
Hmm.
Um, so that's what I use for the bigger planes, for instance.
So my other question, and this kind of throws in, safety, right? Which layers should you inject in? And so, the common area is the forehead where you have wrinkles right across, and also in the glabella region. And we always have discussed that, especially the glabella, if you're trying to treat the wrinkles in that area, that you have, this is a danger zone. But the forehead itself as well, a lot of vessels are in the superficial plane close to the skin. So how good is your technique, and how safe it would be to use this to correct any furrowing in the forehead or in the glabella region?
Well, that's why I like the hands-on trainings because it's safe if you know what to feel.
Yes.
And of course you can watch YouTube and see how it's done. Uh, but I always say when I do a hands-on training, I want you to feel more actually than you do because you can feel if you're in the dermis. And
Mhm.
you're a surgeon, you know intradermal suturing.
Yes.
You know when that thread is gonna grab or when it's like
Yep.
in loose air underneath, it's not gonna do anything. You know the feeling, you can enjoy that resistance you got on the needle because that will tell you that you got material on that will keep it together.
Right.
It's that same feeling of resistance that will tell you that that particular injection, that particular little strand of gel will give you strength and not be in subdermal tissue where it can either give volume or go into an artery or anything else
Right.
exciting.
Right. My other question is, and obviously, when you're attending your course, then you will get all the important information. But I'm curious, is there a preference in terms of the product, in terms of G prime that you use for the rejuvenation for the Fern technique?
Yes, I like high G prime. I prefer from Galderma, I prefer the Restylane, the classic one,
Okay.
because it's very sturdy. The thing is, you want the gel to stick where you put it.
Hmm.
And you can imagine that some manufacturers they want to promote a very subtle, gooey, loose gel because it would give a natural result or move with your face or whatnot. Um,
They also talk about
I think if you
hydration.
want strength, sorry?
No, they also talk about hydration, right? Lower G prime, more water
Or
attraction
water
to the skin,
traction.
looks
Yep.
better than the skin boosters,
Yeah.
right? Yeah.
Yeah.
But for
But if
you,
I want to build a house, I need a brick.
gotcha,
If I want strength, I need something strong.
gotcha. Okay.
That's the basic. And when I need volume, it's not that important what you put in. But as soon as you decide, okay, I want to put this gel in the dermis to give strength and no volume or no relevant volume,
Yep.
then I want something strong.
Okay. And, I mean, I've seen you demonstrate the technique. The results were amazing. I think the first time I saw it was in Bangkok. And you were treating the marionette lines, you were treating the nasolabial folds, and I thought the results were fantastic. But I was watching it and I was like, there's so many pokes into the skin. How do you prevent these patients from bruising?
You don't.
Okay, at least you're
You don't.
honest.
Yeah, well, the thing is, I mean, and that's the weird thing about marketing and stuff. I mean, of course, you want to reduce bruising as much as possible, but if you cut someone's face open, you accept the fact that they need to heal from that, right? There's no way around it.
Yep.
And if you want to put hyaluronic acid in the dermis where it doesn't move, you're forced to make a lot of small injections because it will not go to the place where you want it automatically. You have to force it into that dermis.
Yeah.
Means you have to make like an embroidery in the skin to place it exactly where you want it, thus giving you sometimes hundreds of injections. But bear in mind, if it takes 2 days to heal from 5 injections, it will take 2 days to heal from 100 injections.
Hmm.
So, yes, prepare them for downtime, prepare them for a few days without very important social gatherings or photographs or shit like that. And then they're fine. And they understand.
Yep. Yeah, no, I
Patients do understand.
Yeah, no, what you're saying is like preparation. There's no complications. There's only expectations, right? If they know something will
Yeah,
happen, then they'll be much more acceptable of what's going to happen. So that's a really good.
absolutely.
The other thing that I wanted to know is, because when people come in, they always ask, first of all, is how much is it? Okay, we're not going to talk about that. But the second thing is, how long is it going to last? So, what would you estimate the longevity of this treatment to be?
One of the first models I did back in 2007 for the article in the journal Drugs and Dermatology, he came back 3 years after being a model,
Hmm.
and his nasolabial fold was still massively reduced. Um, and we know now that hyaluronic acid stays much longer than we anticipated. And what brilliant people in Michigan, Kwan and Wang, they did research and they injected the skin of the buttocks of elderly people with Restylane to see what happens to the fibroblasts, what happens to the collagen.
Mhm.
And actually, they see that the fibroblasts, through the injection of Restylane, have like months and months of stress, which makes them produce more collagen as if they were young.
Yes.
So you can imagine that if you make a scaffold, which is gel plus dermis giving strength, now it's gel plus dermis plus extra collagen
Mhm.
giving even more strength. So if I have a very uh, um, difficult patients with very thin skin, very weak skin, I say, well, I'm not going to treat you just once. I'm going to treat you now.
Hmm.
We'll wait for 2 or 3 months. We wait for the collagen to grow. Then I'll retreat you in exactly the same manner. And that because the foundation has been improved, you'll have a better outcome the second time. So you can really build up. And as you said, there's expectations, there's no complications. If you can explain that to your patient and the patient accepts that, and instead of being dissatisfied with a suboptimal result after one treatment, they really understand the stepwise approach where you can build the skin strength up to wherever you want it to go. But the thinner the skin, the more steps it will take. So the under eye area and the upper lip lines will take more steps than the marionette folds.
Hmm. Okay. And the last thing I want to talk to you about, because I mean, just hearing what you just said, I mean, could this be used as an anti-aging? I mean, should you start doing this because it is sustaining this fibroblast, right? It's keeping them younger for a longer period of time, more collagen deposition. So, I mean, should we be waiting until we get the wrinkles, or should we be start doing this when we're younger to kind of prevent this from happening? Like be more proactive because the technique would be ideal.
It would be. I'm pretty conservative being Dutch. I'm not that much into being too proactive and treating 25-year-olds
Mhm.
to prevent stuff. But yeah, I mean, I've been doing it on my face since 25 years, and it doesn't change that much, right?
No, you look great.
I'm 56, and when I see something change it, I adjust it and put in some PLLA and some ferning, and it stays pretty good. Um, so yeah, I mean, as a Dutchman, I wouldn't start before 35 or before wrinkles or before 40. But I think technically you're right.
Okay.
If you catch it before it happens, yeah,
Yeah, no, it kind of makes sense. I mean, I mean, a lot of people are now into longevity things, anti-aging things, pro-aging things, and it's actually filtering down to younger and younger people, right? So we're seeing people in, well, for a long time now in their 20s that are starting to do these things, and that's why you have all these different diets and all these supplements that are, being utilized by younger people because they want to be as young as possible. So I
hmm
actually think that this actually has a potential as a preventative measure. So I can't wait to see it
absolutely.
when you're here in Toronto. And so you're doing the Cross Canada tour. I know you're going to be here in my office on September 13th, but when do you arrive and where do you arrive first?
I arrive in Calgary.
Okay.
On the 11th, I will do a workshop in Calgary on the 12th, then Toronto, then Ottawa, then Montreal, and then right back. So I will not be in the country for more than 5 days.
Oh my God. That is a
Yeah,
that's a really busy schedule.
it is. It is.
Well,
Yeah,
you know what? I'm looking forward to seeing you here in person. I got to
likewise.
see this technique, on a video conference. So I want to see it live. I think it's pretty amazing. So I think your breadth of knowledge is significant and your experience, right? And I like the fact that you're doing something that is for patient, right? For the best outcomes. It's not so much let's follow the leader, let's follow the trend. It's what's right. And I think that's very unique about you.
Thank you so much. Thank you for this opportunity and for the opportunity to train in your office.
Oh,
Much
listen,
obliged.
anytime. Now, here's the question because you're wearing the shirt. Show us the shirt because there you go. Once you
There
convert,
it is.
you'll barely return.